I want to move to the wonderful things that we have, to the area where both gentlemen has also mentioned, compliance. We can educate, we can do quizzes and do quizzes. How do we tackle our colleagues' compliance in the real world?
Right.
What, gentlemen, any one of you want to start, please?
I think that's a very pertinent item that you brought up, making sure everyone is compliant to whatever you're doing, right? I think first of all, it's the same as how we would approach any other quality initiative. You need to get the buy-in. You need to get the stakeholders buy-in. You need to get advocates. You're not going to change. You're not going to convince an entire room of people or change their culture or their approach towards personal safety by just putting out trainings and modules. People need to buy into it. So you need change agents. Those are the people who will be able to get that done. That is one, in terms of getting the change done. But in terms of compliance, I think however you run around, it all comes back down to audits. It's the same way how we do, like in my hospital, my infection control nurses, they are fantastic at their hand hygiene audits. They go around and check doctors, they check nurses, they see everyone. And when they get scolding by doctors, why are you checking my hand washing techniques? The answer is simple. It's about protecting the staff, protecting the hospital, protecting the patient and the family. So I'm doing it. So that's my change agent. So after some time, we realize that the resistance towards these kind of audits start going down, and we start seeing that the compliance goes significantly up. I would say for the past 2 years, my average hand hygiene compliance in my hospital is 97, 98%, and this is verified data, even validated by external people. So it's that process there to get that change agents, advocates, and getting people to buy in. It's the buy-in that's the most important.
So getting human to deal with human. So
Yes.
that's a good point.
That's the best way.
Gary, what do you think? You have success in doing your stigma approach for things. So
Yeah, I think it is a very good strategy. Like, for example, I would also use my HIV stigma program, like, because we are putting a very good initiative for the people to do these things. For example, it is for patient safety, but actually, friendly is also related to safety. They are not going to be rejected access to the medical care, and they will be provided with a good quality of care. So it is very important that we put a very good initiative at the beginning for the people. And then it's not only audit or monitoring, right? And somehow, for example, the hand washing is, okay, if the infectious disease doctor goes to every ward and do their hand washing properly, and it will be a very good example for everyone to see that, right? But if the infectious doctor himself is not doing these things, I don't think the other people will follow the rules. So inside the hospital, I think that you need a lot of the people doing the right thing as an advocate. In my stigma program, we have an ambassador trying to help us to propagate the concept of being friendly and doing the good things. So I think it will become a culture. So the culture will grow, so you will have more and more people will follow it's not only follow, it's they trying to do their best, trying to do the good thing like what we said at the beginning.
Actually, I want to add on to that. I think where we are both coming from is purely looking at culture. Culture becomes sustainable. If you
Agreed.
only have to keep on doing audits,
it won't work.
it's not sustainable.
Yeah.
As long as you build it into the culture of the organization, then...
Fully agree, because there's so many things I see that audits, when it comes to audit, then everybody stands up and do their work. When the audit is finished, then we go back to the old ways. So that happens a lot in our culture. But Professor, what do you think about using some, and in your slides I saw it earlier, process engineering? Right. So how do we add process engineering to support other than building that wonderful culture? So what do you think, what are some of the thoughts about using process engineering? Do you have some examples that you have used in terms of process engineering to support them being better in doing what they're doing?
Right. You mean by a kind of engineering control? A kind of, right. So in the past, people don't care about what they say, right? What name, like, oh, I said, this is a local exhaust ventilation system. This is air change rate. It's a kind of new term for those hospital workers. But I introduced this, 15 years ago. But I kept telling. But one thing for our healthcare people, they're very well educated, right? We have to show them the figures, what's the difference when we measure, and then they see the figures and oh, that's helpful, right?
Communication of the results.
With
Okay,
visualization as well.
Yes.
An example, and follow up and show, like we didn't have really the equipment to do that. Luckily, our boss, right, our executive director, provide some budgeted, and then we train safety officer to measure the air change rate in the room, and then to show them, show and see. Okay, now I make the list. We have about 188 room that about 50% has lower the standard. They didn't know before, right? They was surprised, and I try to say this is standard. Maybe the question came back to me, why we need standard, right? Because we don't have money to change the structure, and if just you measure it, but we don't share it doesn't matter, right? This kind of thing, but just keep doing. Keep doing, keep telling.
So you basically built in a regular monitoring program.
That's right.
As part of your process.
That's right.
So that they understand that there is a more, instead of audit, but there's also a more regular monitoring program.
That's right.
So having tools and processes that we can support them to understand the actual result and what actually is.
Meaning.
It
And
will
then,
help them think better and maybe be better in terms of building that culture.
Sure. And yeah, I think the culture is important. But to work with so many people, you need some legislation, especially public, all things with the public. You cannot tell people to lower the sugar of your food, right? One each. Then American would say we have to have the food label with the small part, just small portion of. You need legislation. Public health is the 3 words: legislation, legislation, and legislation. Right.
Okay.
We can't do anything like
Without
telling you to
legislation.
exercise, right? You cannot because you know, like ourselves, some days you feel lazy to continue some work, but if you have the compulsory to make it, the hospital who have the annual health checkup almost 100% in Thailand is the hospital belong to the Ministry of Defense. Because they can control.
Correct.
Yes. Why? Because the
Very
Ministry of
disciplined.
Defense, yes. They said we need 100%. People have to have. But in our university, could I ask you to go to health checkup, right? It's a different term to tell them.
Okay.
Right, that's the culture. So just coming back a little bit on that, when we measure that and we show them how bad it is on the ventilation, and then for COVID, that really speed up from their understanding because they were afraid of the COVID. So they become, could you come and get your team to help to support this type of thing? Yeah, I think COVID speed up our safety, personal safety.
Thank you,
Thank you.
Professor. Thank you, gentlemen, and thank you, Professor Naesinee. We are running out of time. We are happy to take some questions if there is any questions from the floor or from online. We have 170 people who hopefully they are still listening to what we say. Those who want to speak in Thai can. We have translators here, and we also have people who can speak Thai that can translate it for us here on the floor. Any questions?
What is the definition of the labor? Does it include research, activity, sales, training, learning on work? Well, everything. People, you mean the labor mean people, they work, but the definitions thing about the name of employee. That's a little bit different. So employees is mean you have to have people to be paid for you, right? That's the term in Thailand. There's a paper to me that I have the reviewer mention about that. My paper say hospital employee in English. So the reviewer said, you need to change to healthcare worker. I return the comment and insist, my focus group is employees because I talk about hospital who under the payment from and
That includes people who works for other services in administration.
That's right.
Your reception, the cleaners.
Right.
So they are considered the employees
Sure.
as well. So I think
And
that's good.
I would maybe she or he. Oh, Ken Takahiti. Right. So I have to answer. Labor in Thailand also include informal workers as well. Before this is only formal workers, but the new regulation is saying informal workers.
I would like to get the tactic to convene a multidisciplinary team to join us for personal safety, especially who is a little bit tougher. Okay. So anyone wants to say anything about this comment?
Can I?
Yes, please.
Right. It has to start somewhere. Simple as that. You just have to decide that you want to start. And when you are looking at a multidisciplinary team in a hospital, do not constrict yourself. I want a doctor, I want a nurse. No. Basically, every department should have one person who is in the team. That's it. So that gives you a good cohort of people who know what's going on the ground, who are able to discuss things and try to keep it as open as possible. Highlight every issues that you all have. You probably on your first meeting you would highlight 2 items. Act on them. Along the way, once you your team starts seeing that you are acting on these issues together, they will start bringing up more and more issues. So that's how you would get this hospital safety committee, I would say. I won't use just personal safety, but just hospital safety. So that is your umbrella. Then you can have subcommittees below it. But the main thing is just start. There are people who may not buy into your idea. There may be senior leadership which don't buy into your idea. You just have to start doing it, start showing the results. And the best part is your hospital employees will respond to it, they will resonate to it because they know as an organization, you are looking after them. That itself will get you that buy-in and you will see it over time. But it's not a one-day journey.
Yeah, I think it's not easy. it's not easy. In Taiwanese culture, normally, if we need a multidisciplinary team, somehow they will only select the chief of the department, right? You collect all the chief of the department and talk to them, but actually it didn't work. It never works, right? So someone that we need, like what Dr. Sham has already said, that someone in the department, but it's not necessarily have to be the chief, and then they will have the impact within their team. So they'll go back and then they're trying to implement everything. But of course, you need a leader. For sure, the leader should be someone that in the above. So, for example, the superintendent, but he's super busy, so the vice superintendent, anyone from the above, leading the team together with you, and then with all of the team members together. And of course, continuously, you're trying to implement some legislation or some works. Yeah, that's what I think.
Basically, they also need to have protected time to be able to carry out these initiatives.
Yeah, so when I was looking at Professor Naesenee's presentation, they have a team dedicated, they could have pinched the staff from the nursing, they could have pinched the staff from whichever the department who are interested to do that, but they dedicate a team. And that's why I think it's beautiful, because now you have a dedicated team member, and it tells the whole organization within the hospital that I mean business. And we really want to do well for the personnel and everybody who comes into the facility. So I think that's one of the suggestions that I think will be brilliant to really start that policy within the organization to have that team. Then it means business.
May I? Yeah, I have two strategies myself. When I first did that, I put to my slide, it has to start somewhere with someone, by someone, right? So I was a someone, right? I was a someone when I was there at age of 32, I think. Yeah, it's a long time. Now almost 60, right? Age of 32 is that my long journey. You have to be long march and determine that it's important, right? You have to trust yourself first. I approached the group of the worker who actually really at the risk group. You know who? The maintenance worker, right? Engineer. I did talk to them, but they were male. They are male, right? They are male gentlemen. The perception, their culture, everything is safe for them. If they wore the PPE, it means he didn't look like the man. Oh dear, it's okay. I understood about his behavior, so I changed a little bit. I talked to nurses first. So I went there and I talked about occupational health hazard for nurse. The nurse really nice. The nurse, like head of the nurse, welcome me and then join me on many activities. And you start with someone with somewhere, and you get people coming along up to now. Yep. And then my next strategy, I have already people around with the only operators, not the executive, right, sure. Board of director. Now to drive this to continue as a kind, it needs regulation. You can't deny regulation for safety, right? The standard has to be in your hands always. You need the policy, you need the top of people to understand, and then I drive the executive team. And 100% of this, our dean and all the executive board, and this my 4 years, I was very happy working with them. All of them, 100% attend as a safety officer at the administrative level. But I didn't leave them to work. I took my staff and said, today, we have the dean attend the course 6 hours, 12 hours. All we have to do, help them. So at that time, they have learned from the online, right? They have 2 monitors. One, he had a meeting with other things. And the other, he learned safety. Supervisor, but he had to do, we have to allow, because they had to have certificate. And my staff had to work belong, like they have to make the test, support. They have to answer. And then a kind of key message. And he feel comfortable to get past. I was talk at the back and phone me, Naesinee, I thought of he. I thought I couldn't make it because it's time consuming and it's difficult. I said, yeah, I'll get the stuff with you now. Please, please. And then he said, oh, I've done it. And after I know about the story of safety, then next thing, if you ask for the support, this day, every meeting which I do every month, safety meeting. Either dean or director of hospital or vice director, the deputy dean of human resource always sit at the chair. So
Fantastic.
I thought I'm successful.
Fantastic.
Yeah, because this is เดี๋ยวถ้าพูดภาษาไทยนิดนึงเนาะเห็นชอบมอบรองเห็นด้วยผู้ช่วยทำ it mean like the top never attend the meeting. If the thing is important, they will be at the meeting by themselves. If they have the slightly thing, maybe something, they'll ask the deputy to do that. It's a kind of a joke to say, you know that
Yes.
whether your meeting is important or not by using the chair. Okay?
Thank you.
Thank you.